Thank you, Katina. That'll be very helpful in our discussions later. So you brought to the fore a lot of the issues that we need to discuss and speak further about. So we're going to move directly into our final panel of the day as they come up to the podium. This will engage a discussion regarding responding to several questions posed by our moderator. The format for this panel is somewhat different than that which we've had earlier in the day. Rather than having individual presentations, the moderator will pose several questions and ask each panelist to respond from his or her perspective to these very specific questions. I'll introduce our panel moderator. She also has been a long-standing member of the Roundtable. Wilma Alvarado-Little is Associate Commissioner and Director of the Office of Minority Health and Health Disparities Prevention for the New York State Department of Health. She's been instrumental in the development and implementation of hospital and clinic-based health equity programs and is a healthcare interpreter and trainer with over 30 years' experience in the healthcare field. She has been a valuable member of my roundtable for multiple years, contributing considerably with her expertise. Wilma, will you please introduce the panel?
Thank you, Bernie. Our panel this afternoon is Ms. Zarita Araujo-Lane. She says it's so much prettier than I just butchered, so I apologize. And Zarita has more than 30 years of experience and is recognized as one of the leading presenters on cross-cultural communication tools for small and large institutions servicing an array of professionals working in educational and healthcare fields.
And I was only 8 years old when I started.
Dr. Linda Kotler is an Associate Dean for Research at the College of Public Health and Health Professions in the College of Medicine at the University of Florida. Her research includes the development of widely used interviews for substance abuse and other psychiatric disorders, peer-delivered interventions to reduce high-risk behaviors, as well as community health needs assessments. Helen Osborne helps professionals communicate with health information in ways that patients and the public can understand. Ms. Osborne is president of Health Literacy Consulting, founder of Health Literacy Month, go Helen, and producer and host of the podcast series Health Literacy Out Loud. And last, but of course not least, Dr. Michael Pashorlo, who is professor of medicine at Boston University School of Medicine. He's a nationally recognized expert in the field of health literacy. He's also editor-in-chief of the Health Literacy Research and Practice, which serves as a forum for the dissemination of high-quality health literacy research and state-of-the-art practices. So our panel is a little bit different. As you see, none of us will be doing PowerPoint presentations. As Bernie described earlier, I will pose a question and then the panel members will respond. We have an hour for this panel and I hope to cover 5 questions. So apparently we have a cab waiting. All right, so let's begin. First question, what do you think it will take to provide healthcare team members with the basic knowledge about issues in caring for and interacting with individuals with mental or behavioral health conditions?